Awesome. Thank you so much. And I want to let everybody know that we're also live. We're live, I believe, over LinkedIn, Facebook, and Twitter right now. So if you speak up, you might be brought. All right. So, we're all here today. Maybe you know me, maybe you don't, but we're really here to talk about building the future of healthcare together. And, I'm an emergency doctor. I practiced across the US for, nearly 10 years. And one of the hospitals that I previously worked for actually used my professional identity and credentials to bill on patient charts after I left that hospital and after I left that state. And I had been practicing and I had felt this administrative burden and this friction and this, confusion about why this is so hard before this even happened. But when that happened to me, it really opened my eyes and made me realize that we as doctors are really powerless in this system. And I had learned about technology called decentralized identity. And that allows individuals to own and control their data. And so when this happened to me, after 5 months, I was able to fight a legal battle and win that legal battle and prove that it wasn't actually me practicing medicine without a license, that this hospital was actually committing fraud on my professional identity and credentials. Once that was all wrapped up, I realized that this technology could be leveraged not only to prevent what happened to me, but to empower us as doctors to own our professional brand, to be able to move seamlessly between private practices and systems, and to no longer be trapped within systems that don't serve us. And so there was an unprecedented opportunity to take this and to share it with the world and build a new system that eliminates this friction and automates how we as doctors work, onboard, communicate, and move throughout our career. So I want you to consider the possibility that if we, the physician community, use these tools to fix the workforce problem, we can fix the access to care problem. And, this new technology can help us do that. And for those of you who don't know what HPEC stands for, it stands for the Humanitarian Physicians Empowerment Community, because that's what we do. We empower the humanitarian physicians to provide the care that the patients need. And so I'm excited to share a little bit more with you. And so this is, kind of how we as doctors feel. We spent our entire youth with our nose in a book, learning to prevent death and permanent disability. And we're basically being micromanaged and monitored. Most of us are now employed. We don't have private practices. We find it difficult to even do what we're meant to do. We're sifting through paperwork, even though we have a computer. We no longer are interacting with our colleagues in order to optimize care. We're interacting with computers. And if you look at the patient, they're feeling it too. And we're the ones in front of them. So in some ways, they're blaming us right now. And there's a disruption and a deterioration of the doctor-patient relationship because of what's going on here with the micromanage and the surveillance capitalism. And so, we are sick of this uncompensated burden of doing all this paperwork, and we're quitting and we're dying by suicide as doctors, but it's really about the patients, and they're also suffering, and it's time for us to do something about it. And that's what this company is about. So what's the problem that we're talking about? If you look at this tiny sliver of a blue line, it represents the growth in the number of doctors since 1975. Compare it to the increase in healthcare spending since then. Compare it to the increase in the number of administrators. And notice this chart is by the thousands of a percent. So with each new regulation, there's been an increase in the cost to the point that now only 30% of every dollar actually goes towards patient care. And it's unsustainable. So we need to start reducing the administrative burden so that we can get rid of the administrators, automate the administrative processes in order to control costs and keep doctors in medicine.
Dr. Houston, did we want to launch that first poll? We have some questions from people.
Oh yeah, please. Sorry, I forgot about that.
No, it's okay.
Sure, let's do it.
We do want to get to know who's in the room a bit better, since we are, gearing this towards physicians and people impacted, and that HPEC hopes to help. So we'd love to get to know a little bit better who we have in the room. So I'm just going to launch a 1-question poll. We'd love if everybody could answer. And I'll just keep it up for about 30, 40 seconds and share the results.
Yeah, we want to know if, who's in the room. Are you doctors? Are you in medical school? Are you patients, patient advocates? Are you health system administrators yourself? And I'll continue as you guys answer this one question. So, we know that the path to becoming a doctor is long. Those physicians in the audience know very well, it takes 11 to 18 years of training. And each step of that training, testing, qualifying, and credentialing creates friction that follows us throughout our career, because each of these steps has to be repeatedly verified in order for us to not only get to work, but stay in jobs and stay in work. But this is what our system is built on, physician care and the credentials that we use to, basically prove that we are who we say we are. And so those credentials need to be verified. And so we're also dependent on a credential verification system that verifies that we actually went through that process and we're safe to make life and death influencing recommendations to patients. And so healthcare doesn't exist without physicians, but it also doesn't exist without us having the credentials and the verification of those credentials. And the current system is broken. And before we show you how we want to fix it, let's just quickly go through how it actually works now. So we have physicians who hold the credentials like medical degrees and licenses and CMEs. And then we have the issuing institutions like medical schools, residency programs, state licensing boards. And I'm talking about all credentials. So even like final summative evaluations and the ACLS and PALS that we do, these are all credentials that we have to have. So the day that you graduate, you currently get a paper credential, and it's the first step in the current process. And so when you want to get to work, or even when you want to open up a private practice, and even if that practice is a direct primary care, cash only private practice, you still have to have a medical license, a DEA. You still have to do your CMEs to renew your medical licenses. So this affects every single practicing physician. So the verifiers make the initial request that you share the credentials. And so whether it's an employer or, just to be able to open a private office, you need to actually prove to the state and the medical board. And so we can't get a job or maintain a private practice without these. And so in most cases, this data is actually protected by FERPA, which is basically a HIPAA-like law around our educational credentials. So legally, we as doctors have to control access to our educational history. And this is part of why we carry so much administrative burden of sharing it and why it's so cumbersome. So then the verifying body has to go back to the credential issuers and say, hey, is that real? And there's regulations around them having to do this, but there's no standard. So each institution has their own internal guidelines, and it's really friction filled. And so the credential issuers have all this administrative work. So they charge people for these credential verification requests, and they go back and forth. And then finally, the credential is verified 4 to 6 months later. It's an outrageous amount of time, costing us as doctors up to $150,000 in income if we had been working. And the systems lose an average of $1.2 million per credentialing event. So this is a time-consuming, expensive, burdensome process for everybody. Everybody hates this. And this is just a tiny snapshot of the journey that practicing physicians take and the systems that we interact with along the way. So these are only a few examples of all of these siloed entities that manage our identity and our identity has to interact with. And none of them work well. None of them are physician-centric. Many of them might become obsolete due to regulatory non-compliance. And then, we as a company have the potential to either replace or interface with all of these. And so we have the only end-to-end solution that can automate the verification process and make your entire career life cycle easier as a physician. Our system is unique because instead of handling the verification after the credential is issued in the way that we just described, like all of the other systems that are mentioned, we automate the process upstream at the time you actually receive the credential. So with our two interoperable products, we can achieve an automated, secure, user-centric, and compliant way to issue, verify, and manage identity credentials from the beginning to the end. So we create a permanent and automated solution for workforce mobility. And mobility translates to practice autonomy, not only by reducing these repetitive administrative tasks, but instantaneous freedom to prove that you are who you say you are, to prove your credentials, creates the freedom to instantaneously move out of systems that are not serving us and into systems that are. And so it gives us leverage as doctors to serve our patients. And so in the end, this makes our lives easier, but also makes patient care safer. So how does this actually work? How does the system actually do things better? So you're still going to graduate. You'll still probably get a paper credential. You'll still probably put it on your wall, but now you'll also get a digitally verifiable credential into your wallet. And so through secure decentralized identity protocols, our system will immediately hash or document proof that that credential was actually issued by the issuing body. And they'll do that onto a distributed ledger or a blockchain, creating a permanent, immutable, and accessible record. Now, when a physician needs to be verified for a job and presents the paper credential, it also includes the digital credential that comes along with provenance logs that points to the blockchain, demonstrating that the credential is actually authentic and issued by the issuing institution. So immediately the verifier can actually read the ledger, know that the credential is authentic, saving months of time and millions of dollars. And so with the power of artificial intelligence and these interoperable, decentralized identity protocols, we can develop automatic re-verification tools so the credential issuer will never have to manually verify their credentials again. And we can have an automated and seamless process for everyone. So you as a physician always stay in full control of your data. That's what decentralized identity does. And so you can also get to work immediately, get to work part-time, work here and there, and not have so much paperwork in order to be able to do that. And so people ask, how do we make money? The EverCred system is purchased by credential issuers. So it's a SaaS model. It's a computer program model. You have a setup fee, a per user per year fee. And so when the issuers use this EverCred system to issue the credentials into your wallet, that credential is digital and automatically and permanently verifiable. So the workflow is not going to change. The verifiers are still going to ask you for your credentials in order to verify. But now you can immediately share your digital credential that's automatically verifiable. And so this is also compliant with FERPA. So now about payment. So with digital credential comes an automatic payment request. And so while we await payment, the credential will be held under smart contract until the payment's made. So once the payment's made, the digital proof is released and the credential is verified. Both the holder and issuer earn revenue for participating. Now, this is a very important part. When you think about it, you went to medical school, you spent hundreds of thousands of dollars going to medical school. Why are you paying again? Why are you paying with your time and with money to verify all of this stuff? We should be able to earn money on this data. So issuers have always charged for this. They can continue to generate revenue. You as a physician also can generate revenue with this system. And so we as a company will also get a payment for providing the service, and the verifiers have always paid, so they'll continue to pay. And so, we get paid every time a credential is issued, checked, verified, and we get paid for the EverCred SaaS model. So, all of the expensive and friction-filled systems go away and nobody really loses in the end. So, this cutting edge company, it leverages both decentralization and AI, where we can put practicing physicians in the driver's seat and automate all these processes. No longer will we need these old systems that are forced upon us. And so for those of you who want to join on this journey now and participate at this early stage, you can be rewarded for your forward-thinking insight and for taking action to own this solution collectively together. And so we're creating a new marketplace in an old industry with these two interoperable products. We have the HPEC Identity Wallet, allows you to hold, store, share, and keep your credentials. We have the EverCred system that allows you to authenticate your identity. It automates regulatory compliance. It frees up time for the credential issuers and verifiers. And so I want to make it clear, because a lot of people are skeptical that this is even possible, but the EverCred system can verify credentials in the old traditional way. For those of you who have access to the wallet, you can look at your wallet right now and you see underneath your credentials that you've uploaded that it says uploaded. We have an ability to click a button on the back end and make you verified. And so we as a company are going to become a legal credential verifying organization so that you have credentials that are verified in the traditional old way while we build out this truly decentralized ecosystem. And so, this is a path to early revenue, and it's a path to also build out the ecosystem as we build out this new model. So HPEC is also not just a credential wallet. It's actually, there's a social layer and a peer-to-peer connection and communication layer. We're on all these Facebook groups. They're siloed, they're centralized, they're controlled by a few members and then the one person that owns the whole Facebook company. So if we have a decentralized system of communication, we can have private communications amongst our peers. And so we can build this also to build referral networks that are personalized to us as independent doctors. When you're on the app, you'll notice when you connect with people, you can say, hey, how do you know them? Did you go to medical school with them, or do you refer patients to them? And so we're building a social graph of data that will allow you to essentially get your patients the best care. And so we also have a system of governance and voting and democracy that we can implement for inclusive stakeholding and shared decision making around, policies and practice guidelines. Our national and regional medical associations are not serving us. We're paying all these dues and we don't even know what they're doing with them. So this is a chance for us to, with transparency, govern ourselves. And, with your profile, I also want to let you know that you can make your profile public in the future. So patients can also find you, and that's going to be something that you have full control over. So we can replace these horrible online physician search engines that essentially scrape our data without our knowledge or consent, and then do gatekeeping nonsense that prevent patients from being able to find us and charging us enormous amounts of money just to be able to connect with the patients that were looking for us in the first place. So with this tool, we can empower you, the physician community, to own the system that we are rebuilding for the future of healthcare. Uninfluenced by outsiders, only built by us, and centered around the needs of us and our patients. Oh, the poll just, I think, got completed. We're almost done. So for those of you who haven't completed the poll, there's a couple in there. We would love to learn about you, and then we can close it out. So let's continue. So the total addressable market for credentialing is $5 billion, which is where we're going to start. But when you think about it, the United States healthcare system is a $4.2 trillion system. It's the fifth biggest economy in the world. It's bigger than, goes, US, China, Japan, Germany, and then the US healthcare system. So it's an enormous amount of money. And physicians control 80% of the flow of that capital. If you think about it, it's with a stroke of our keyboard, we decide if a patient gets admitted or discharged, gets surgery, medication, or physical therapy. And with the stroke of that keyboard, we're also generating data. So regarding that $450 billion patient data industry, we're generating not only revenue for the systems, but we're generating data. And that's how systems make money. And so controlling us and controlling our behavior and preventing us from being able to leave hospitals because there's so much friction of credentialing is part of how they keep us in the systems and how they commoditize our data. But with HPEC, you own your data. And when you think about it, the current data is dirty, because we're being incentivized to hurry through patient encounters, and it leads, us to sometimes over-order, over-treat, over-refer. So, document too quickly, not document fully what we would normally document if we were in our private practices, because we're being incentivized by administrators to document it this way. And so our regulatory compliance system has the power to create clean, authentic data and to integrate into our greater healthcare system at multiple levels in order to reduce fraud, waste, abuse, and redirect capital in the direction of patient care. So as a company, we'll get a piece for making it all possible with revenue projections in the tens of millions. And so now that you know how the technology works and how we're going to generate revenue, I want you to consider the possibility of believing that this is all possible, because this is the biggest hurdle for people. This technology is coming with or without us. The industry is moving in the direction of digital credentials, of more automation, and everybody's trying to solve this problem. And many of them are looking at decentralized identity, but no other company is doing it in this physician-centric way. They're all trying to still serve the institution. So this is the one opportunity that we have to build this for us. We are the first to market, and so we have first mover advantage. There's hundreds of other credentialing companies that are solving this problem downstream. We're the first and only company solving this problem upstream, creating an automated digital solution. And so this is also a very rare moment in history where technology trends are actually following regulatory trends. The American Association of Medical Colleges even mentioned this in one of their talks recently. The 21st Century Cures Act and the TEFCA standards that are being developed, they include physician data. The No Surprises Act has physician data layered in. They need authentic, real data about us. California Data Protection and Privacy Act. So long story short, let's face it, we need this, and so do all the stakeholders. It's not just us. And so this effort has been developed and fully funded by the physician community so far. We used the original funding to launch the product that's now in beta with over 1,000 physician members representing over 100,000 patients. We've built partnerships with credential issuers, and we're ready to continue to scale. And our pilot partners include Norman Regional Medical Center in Oklahoma and the University of Buffalo in New York, where they're both going to use the Evercut system to issue residency certificates to graduating doctors. And we also have an agreement with a telefingerprinting company that holds patents to do remote fingerprinting globally, and also has agreements with all 50 state medical licensing boards. So if we're able to digitize their system and make those fingerprint credentials digital, put them in your wallet, you can then have a pathway to interstate medical licensing reciprocity or quicker licensing across state lines. And this is a small sample of physician leaders who are forward-thinking enough to have supported this movement already. We did a crowdfund in 2020, and that's how we've been able to launch these two products. And they did it because they know that this is so needed. And I know you guys understand that too. And I believe that we can do it together. So as I mentioned, we successfully deployed that capital and we launched our products. So now we need to enter the next phase, which is including preparing the EverCred system for this enterprise integration. So where we can actually build out this fully distributed system. And so to accomplish this, our next round of funding is targeted at $5 million. This would give us extreme confidence that we'd be able to be revenue positive in 18 months with plans to grow, scale, and expand. And we know that this restructuring of our healthcare industry is inevitable, and we have the power to do it right. We've already seen what happens if we wait and hope that somebody else fixes us. It just gets worse. So with your support, we can change everything. We can rewrite the rules and take back control of our professional careers, our sanity, and our lives. And this is our dedicated and passionate team, and we wouldn't be able to do this without them. And this is the future that we can build together. And so we're asking you to join us. For those of you who are listening in on the live session and who are just getting to know us, please go to the website now. Put your information in there. Let us know who you are so that we can stay in touch with you. This is a very unique, very rare moment in time where we're building a company that's physician forward, physician centric, where we are making opportunities for it to stay physician owned. And so if you're serious about taking control of your livelihood, your practice, then take the step to protect the credentials you work so hard for. Indicate your interest on our website, and there you can enter your information. And for those of you who enter your information before the crowdfund that we've applied to goes live, you'll be put on a list where you can get special perks. And if that happens after it goes live, you won't get those perks. So this is a time-limited opportunity. And so, we've structured it for anyone to be able to invest, even medical students, because the minimum investment will only be $500. And so we know that you're serious about ethically caring for your patients and advocating for restoring and preserving the sanctity of the doctor-patient relationship. The reason you've taken your evening to be here today is because you care about this stuff. So for those of you who are, who care enough, I want you to translate that seriousness into a minimum but powerful investment of $5,000 if you're able to do that. And if you do it on the day of the launch, you'll be able to take advantage of all additional perks. We see this as a very small amount compared to the price that we've already paid and the price that we'll continue to have to pay if we continue in this old way or continue to do nothing. So you have to ask yourself, what is your career worth to you? What is peace of mind worth to you? As a company, we aim to give you your time, peace of mind, and potentially a return on your investment back if we're able to execute as we plan. So we want to keep this physician owned. And so we've structured this to make it easy for anybody to invest. And the rest is now up to you.